Unilateral gynecomastia or gynecomastia only on one side. That is, if you have a swelling of your chest just below your nipples only on one side of your chest. Hello friends, I am Dr. Ankit Gupta. I am plastic surgeon, and if you have been following us, we make a lot of videos on gynecomastia because I get a lot of patients of gynecomastia. Today we'll be discussing in particular unilateral gynecomastias. In my practice, I do get many patients of unilateral gynecomastia, and it is a bit difficult to treat these patients because when you are to achieve the symmetry, it becomes more difficult to achieve a symmetrical chest in somebody who has already a lot of asymmetry in their own chest. So we'll be discussing today 5 different cases. I'll be showing you 5 different cases that I had operated in recent past, and I'll show you what they looked like before and what was done to them and how the results came ultimately. So as you can see, this patient, he is a 35-year-old gentleman. He is married, has kids, and was always bothered with his unilateral gynecomastia. As you can clearly see, on his left side, there is a huge gland. On the right side, it appears very normal, but on the left side, you can see and you can appreciate how different it is. And this is what a unilateral gynecomastia looks like. For him, we did a standard liposuction along with gland excision. We did liposuction on both the sides. Even on the right side, we have done a liposuction so as to make this both sides of the chest look equal. So we have done liposuction on both the sides, and then we took out gland from the left side, and this is the gland as you can see from the left side, and this is how he looks ultimately after 2 days when he came back for his review. So on second day, this is how he looks, and you can appreciate now that both sides of the chest now look much more symmetrical. So now coming to the second case. This case is of a 18-year-old guy, and he had right-sided unilateral gynecomastia. As you can see from his pictures, he is not fat at all. He is otherwise fit, does not have any fat in his body, and for him, we only did a gland excision. We need not do any liposuction in such an individual in whom there is almost no fat. This kind of patients appear very less. As you can see in him, this is the gland that we had removed, and this is his after picture. So after about 1 month, this is how he looks, and you can appreciate now the symmetry in the chest. This is the comparison of before and after. Now this is the third case of unilateral gynecomastia. Although you can see that on the left side there is a gynecomastia, but in him actually the gynecomastia was present on both the sides, but the left side was much bigger compared to the right side, and that is why I have kept it under the category of unilateral gynecomastia. In him we did liposuction on both the sides and we did gland excision on both the sides. But in his case, as you would have imagined, on the left side the gland that was removed was much larger compared to the gland that was removed from the right side, which is comparatively much smaller, and that is why his left side was much larger than the right side. And this is his pictures after 2 days, and you can appreciate now how much symmetrical the chest looks even after 2 days. Now coming to the fourth case, this guy, he was extremely fit, very muscular, used to work out regularly, 26-year-old male, and he had right-sided gynecomastia, and he tried his level best to reduce it or to get rid of it through his exercises and all the gym trainings that his trainers told him to do. But even after all that, his gynecomastia, although it had been less visible, he still had a huge gland on the right side, and maybe you cannot appreciate it clearly, but if you see closely on the right side, the area just below the nipple is enlarged compared to that on the left side. And we did his liposuction, but since he had almost no fat, his body fat percentage was only 8%. There was almost no fat in his liposuction, and when we went for the gland excision, we were able to take out this gland from his chest. I would also like to show his pictures after about a month so as to show you how the scars heal. And this is his picture after about 1 month. This is the point from where we have done liposuction in his axilla, and that is the point I usually start off or I use to do liposuction. And this is the cut on his nipple and areola, and this is how it looks, and this is a zoomed picture, and I don't think anybody is looking at your nipples so closely. And this is what the scar that will remain, and this will also reduce or become less apparent in the coming 1 to 2 years. And this last case that I am showing is of again a 18-year-old boy, and he also had gynecomastia only on his right side. Even as you can appreciate in this patient, there was absolutely no fat, and we did only a gland excision in him, and this is the size of the gland that we were able to take out, and this is how he looks after the surgery. So in short, I have shown you today 5 different cases of gynecomastia, which are all unilateral gynecomastias. So in patients who have less amount of fat, we can do this surgery under local anesthesia, but in those patients who have a lot of fat, or if we have to operate on both the sides, I usually prefer general anesthesia. And it all depends on the patient's preference. It all depends on how much of discomfort you are able to tolerate, what is your tolerance of pain and everything. And you can always get in touch with our team, and they will guide you regarding which kind of anesthesia would suit you. You can always share your pictures with us on WhatsApp, and we'll be ready to help you as soon as possible. And I'll personally look into the pictures and reply as soon as possible regarding your treatment and what should suit you. Few things that you should always remember in cases of unilateral gynecomastia is that very rarely these could be breast cancers. It is very much unlikely that both sides of a breast will have a breast cancer. So in cases of bilateral gynecomastia, we usually do not expect breast cancer. But if somebody has a unilateral gynecomastia, and if it has increased suddenly, when it has appeared suddenly, or if it is very painful, or if there is any discharge like blood or pus coming out, then in those cases you need to get treatment as soon as possible, just as to make sure that it is not a cancer. Very rarely there can be breast abscess, but these all conditions are very rare. Most of the cases are benign, that is, most of the cases are non-cancerous, and you should not be worried about the unilateral gynecomastia. Whenever you are comfortable, whenever you have about 3 to 4 days off, whenever you have few days off in your schedule, you can easily get this surgery done. My name is Dr. Ankit Gupta. Do subscribe our channel if you want to see more videos regarding gynecomastia. Thank you.